Hi, my name is Rochelle Martin. I'm from New Zealand, and here I am the head nurse of the ETC. And this is our site. I'm going to take you for a walk around and explain a bit more about the facilities. So this is the triage area. This is where the patients come when they first arrive. They come through the ambulance bay on the ambulance, and they get escorted inside here where they have a seat, and they get assessed by a doctor and a psychosocial person to work out which ward they need to go into. So after the patient has come through triage, they get admitted to the hospital. This is our main hospital. There are 4 different wards, and depending on the patient's status, they get admitted to a different ward. So we have suspect, probable, confirmed, and convalescent. So in here we have the suspect ward. This is where patients go after they're first admitted if we don't know their status yet. They get a blood test taken, and while we're waiting, they stay here. And then after that, the patient either gets discharged or they get admitted to the confirmed ward. And this is our probable ward. It's similar to the suspect tent. However, this is for patients who've had close contact with an Ebola patient already, and they're probably more likely to have Ebola. So they have close contact and 2 symptoms of Ebola. This is the bathroom block. There are one of these at the end of every ward. As you can see, it's really large. Each cubicle is about 2 meters by 2 meters, and this is to enable the patient and 2 members of staff in full PPE to assist them. And there are toilets on the side and showers on the side. This is our confirmed tent. Once we know the status of the patient, they get admitted here for treatment. This is where they stay for the duration of their treatment, and when they start to get better and have a reduction in their symptoms, then they get admitted to the convalescent tent, which is where we'll go next. This is our convalescent tent, which is our final ward. This is where the patients go when they've had a few days without symptoms, they're starting to feel better, and they just wait here until they're fully recovered, and then they can be discharged home. So as you see, we've come straight from the convalescent ward down there, right through into the discharge shower. This is where the patients go when they're fully recovered and they're ready for discharge. They have a nice shower with 0.05% chlorine, which gets rid of any extra Ebola left on them. Then they get given a clean set of clothes, a fresh towel, and they come through and they see the doctor and the psychosocial person to arrange their discharge planning. So we are now standing outside of the Doffing Tent. As you can see, we've come in from the red zone, from the confirmed tent. All the clinical staff who've been inside, they're now coming out, and this is the area where they decontaminate. So in this area, we have a sprayer who is spraying them down at the same time while they are decontaminating, so taking off all of their infected PPE and getting ready to exit properly from the red zone. And then on the other side here, this is the laundry. So this is where a lot of scrubs gets washed, and as you can see, we've got aprons that are hanging up drying. There's a lot of laundry to be done in this place, but they do a very good job. And down towards the end here, we've got the command and control center. This is where all the clinical staff gather together and they discuss the plan for the day, they discuss the patients, and this is where we plan for any admissions or discharges. So this is the other side of the laundry. This is where they have the machines, the washers, the dryers, and they do the washing part of the process. And if we go further down here, you can see in towards the red zone. On the other side of the fence, that's where the red zone is. This kind of shaded area is where the doctors can actually communicate with the patients who are ambulatory. So they can come to the fence and they can have their ward rounds there, and they can do the patient assessment over the fence. And that's a nice way that the doctors can be face-to-face with the patients without PPE, and they're still protected. And if we go a bit further down here in the green zone, this tent here, this is the donning tent. And as we can see, there are already some doctors and nurses getting ready to go inside. We have all the PPE hanging up, ready to go. And so now we'll go on to the lab. The lab is very important because this is where we process the blood samples, which decides if the patients are confirmed Ebola or not. And the lab can also do testing for malaria. So we are now standing in the white zone. We've just crossed over from the green zone through the locker room, getting changed out of our scrubs into our street clothes and entering into the white zone. This is a good way of keeping the zones clear, so everyone in scrubs stays in the green zone and people who are in the white zone are just in their normal clothes. So we come through the locker room into the white zone. There's the pharmacy to my right over here, and in there we prepare the patient's medications. We've got a few pharmacists working for us who do a really great job, and they have a little window into the green zone so they can dispense medications from there. So now we'll go around and see some of the other buildings. On the side we have the dining hall. This is where we go for staff meals. We have breakfast, lunch and dinner served in here. It's a nice big space, and beyond into the back we have the kitchen, and that's where the staff distribute some of the meals. And moving further on down this pathway we have all the offices to our right. We have 4 offices down this pathway. Right at the end we have staff health, where staff can go if they have any health complaints, and then we have some offices and some storerooms. And this is our biggest storage tent, which is pretty full at the moment, and this is where we get all our supplies from that we need. So I've shown you through the red zone, the green zone and the white zone, and that concludes our tour of the Goal ETC in Port Loko.